It's really important for us, I think, as service providers to think about who might benefit from some specialized interventions. So the Family Treatment Centre in Prince Albert is a really interesting model that serves Indigenous women and their children on substance use issues and substance use treatment. So many women don't go to treatment because they can't find a place that feels safe for them to leave their children behind, or they've already lost their children to child welfare authorities because they've had a substance use problem. So creating that kind of a treatment center that really thinks through what it is to bring in the idea of parenting and support for mothers, even as you're in treatment, is a remarkable achievement by the Prince Albert folks. So working with the Family Treatment Centre, we thought about how could we improve the aftercare response to women with substance use problems who've been through treatment and are now going back to communities. We came up with 4 components of aftercare work: the physical health support, the relational support, the cultural and spiritual connections, and the mental health-oriented, substance use-oriented area. Well, it's interesting, as we talked about those 4 areas of aftercare support, we really noticed that it very much was in alignment with Indigenous wellness models too. So it's kind of exciting that the trauma-informed and aftercare needs are in such good sync with that. In the area of physical health, how might the clinics and others who are in the communities where women return to, how might they really support women's physical health as they re-enter into communities? You know, another part of the trauma-related work in the aftercare period is really all about relationships. And, you know, relationships are so affected by substance use. And relationships with children, relationship with partners, relationships with people at your workplace, if you still have a workplace, etc. So I think, you know, that part of the work in aftercare is so critical, the relational growth and the chance to feel like you can trust and connect to others. The third area was all about the idea of mental health and trauma supports that they might want to think about in that aftercare period and get counseling and further recovery group support on. And we also thought a lot about the area of cultural and spiritual connections as an important piece. We talk a lot about aftercare as a time when you reconnect to work and other important things in your life. And I think that is a really critical part of aftercare work, is to think about that kind of empowerment that gives you a sense that you have meaning and purpose in life and that you're connected to productive work or some contribution to your community that's beyond being someone with a substance use problem. That sense of empowerment that takes you beyond even the healing and wellness in your own life to thinking about the healing and wellness of your community and your family and others beyond yourself is a big part of aftercare growth. I think service providers can create safety as a part of aftercare by really giving people good information about what's available in your community to be connected to, and constantly be saying to women, you know, if you need to come back for more information or more help, we're here. I think that kind of sense of creating a world that is safe and predictable is an extremely important gift that service providers can give women in recovery.